Why do stroke patients experience neuropathic pain? Imagine feeling a sharp, burning sensation or numbness that just won't go away, even long after a stroke. That's because stroke patients often experience neuropathic pain, which is a type of chronic pain caused by nerve damage in the brain or spinal cord. This pain isn't like a typical injury pain. It comes from changes in how the nervous system processes signals. When a stroke occurs, especially if it affects parts of the brain involved in sensing pain, it can disrupt normal nerve pathways. This disruption leads to abnormal signals being sent to the brain, which the brain interprets as pain. This condition is often called central post-stroke pain, and it can be quite challenging to manage. One major reason for this pain is damage to the pathways that carry sensory information from the body to the brain. For example, the spinothalamic tract is a key nerve pathway that transmits signals about pain, temperature, and touch. When a stroke damages this pathway, the nerves can become hyperactive or lose their normal regulation. This causes patients to feel pain from stimuli that normally wouldn't hurt, like a light touch or a cold breeze. The nerves become overly sensitive, a condition known as hypersensitivity, because the brain's usual control over pain signals is disrupted. Another factor involves the balance of signals in the brain that control pain. Normally, the brain has systems that inhibit or dampen pain signals, helping us feel comfortable. Stroke can upset this balance, leading to an excess of excitatory signals or a reduction in inhibitory signals. This imbalance makes pain feel more intense and persistent. It's like the brain's pain gate is stuck open, allowing pain signals to flood through unchecked. In addition, stroke can activate immune cells in the brain called microglia. When microglia become active, they release chemicals that promote inflammation. This neuroinflammation can sensitize neurons involved in pain transmission, making them more responsive or even causing spontaneous pain without any external stimulus. This inflammatory response can linger for months or even years, contributing to long-term neuropathic pain. At the cellular level, nerve cells called nociceptors, which detect pain, can become overly sensitive after a stroke. Changes in ion channels, proteins that control nerve excitability, can cause these nociceptors to respond excessively. For example, sodium channels or temperature-sensitive channels like TRPV1 and TRPA1 may become more active, leading to spontaneous pain or exaggerated responses to minor stimuli. This process is called nerve sensitization and is a key feature of neuropathic pain. Understanding these mechanisms is essential for managing pain after a stroke. Treatments may include medications that target nerve excitability or inflammation, physical therapy to help retrain sensory pathways, and psychological support to help cope with persistent pain. It's important for stroke survivors experiencing neuropathic pain to consult healthcare professionals who can develop personalized treatment plans. Because the underlying causes involve complex changes in the nervous system, managing this pain often requires a multidisciplinary approach. In summary, neuropathic pain after stroke results from damage to the brain's sensory pathways, leading to abnormal nerve signaling, inflammation, and nerve sensitization. These changes explain why many stroke survivors experience ongoing, sometimes severe, pain even when there is no ongoing tissue damage. Always remember, each person's experience is unique, and medical management should be tailored to individual needs. If you or a loved one are dealing with this type of pain, seeking professional advice is the best step toward relief and improved quality of life.